Hi everyone, welcome back to iMumz Ask Me Anything session. So today we have another important topic and a very special doctor from Bangalore. So I'll quickly introduce her and she will explain everything about fetal heartbeat. So Dr. Lavanya Kiran, she is the senior gynecologist in Narayana Health City in Bangalore. So she's been treating so many women on different pregnancy related, gynecology related issues. She has specialization in infertility, endoscopic gynecology, treating PCOS, ectopic pregnancy, and so much. Like, she's been doing a lot in her field, and she is regarded as one of the best gynecologists in India. We are very happy to have you here with us, ma'am, and all over to you.
Thank you, Ansuya. Wonderful. Thank you for this wonderful introduction of yours. Makes me feel very cheered up seeing your peppy face. And I hope our audience will also enjoy this topic equally, because today we'll be talking about a very nice, interesting topic, I feel, which is nothing but fetal heartbeat. You know now how parents feel so good when you're called in to hear the baby heartbeat. I don't think there's any joy in this world that can be compared to listening to a baby's heartbeat for the first time. And then I've seen myself that the tears roll down on from the parents' eyes, and that gives us joy too. But then there are so many things that we need to know about the fetal heart, because, for a lot of them or most of them, it's only happy moments. But for some, it can still be saddening moment at times. We'll see where all it gives us joy and where do we end up sometimes in trouble, and then how do we get out of the trouble, I think would be a gist of today's talk. So welcome everybody. I'm glad that you've all joined in this pandemic. Let's keep each other positive, trying to talk about something good, the fetal heartbeat. Anusuya already spoke to you about me. So what happens on an average global rate? There's so much of neonatal mortality. That is the death in the first 28 days happening, where there are almost 18 per 1,000 live births happen. Here, almost 2.6 million infants are stillborn. This is why I said there are a lot of saddening moments, of which 98% occur in the countries of low and middle incomes. And in this, the most saddening is you come home to deliver a nice, healthy baby, take home a bundle of joy, but 45% of them intrapartum period, we end up losing babies. India itself, there are 22.4 per 1,000 live births, which is great on an average global rate. We're not on the good side, like how we are doing in the pandemic COVID. Now we are on the top list, not for good reasons though. So nearly 0.75 million neonatal deaths recorded, and that's the highest of the world. So what happens? Let's talk about joyous things, at least in this negative surrounding of the pandemic. So a fetal heartbeat starts at 7 weeks on an average. So the general body movements will start becoming organized between 20 weeks and then more organized around the 30 weeks. The fetal movement maturation continues till 36, 37, 38 weeks. Sometimes around 38 weeks, they say there is a little reduced in intensity, there's a little reduced in frequency. Until then, it should be really good. And the criteria for interpreting any of these tests will be varying at different gestational ages. And this is our fetus, and this is how it would look initially. Not very cute, but then, once it starts growing, it becomes the cutest thing in the whole world. And the fetal heartbeat can be detected as early as 34 days. That's just under 6 weeks. If you have a very good quality scans, high frequency transvaginal ultrasound, and remember, you should have a crown rump length of anywhere around at least 2 millimeters to pick up on a good ultrasound machine. We can see, at least if you can't hear, you can see that nice pulsation, So once, especially because we do a lot of infertility, we do our own scans, and initially we can see the baby is just really small, like 2 millimeters, but you can still see that pulsation, and that gives us so joyous moment for us as well. So if a heartbeat cannot be identified, even when the baby is more than 7 millimeters on a transvaginal scan, then we need to think of it as a demise, and then it's a missed abortion is what we'll be concluding. So we have to remember the length of the baby also has to be noted while we are looking for the heartbeat. And this is what your doctor would be doing for you. And they wouldn't simply say it's a missed abortion. So they will see what is the length of the baby and only then tell you what is happening. So a normal fetal heart rate will range anywhere between 110 to 160 beats per minute in the intrauterine period. And like I said, it varies during gestation to gestation. So on rough, the prognosis over 2 to 3 weeks becoming more and more, and around 5 to 6 weeks, you should see that it should at least be 110 is what we would be looking at. And once it reaches around 9 to 10 weeks, it will be anywhere touching sometimes at 170 as well. So between 110 and 160 is considered normal, okay? And sometimes we can see that there can be decreasing and then it shouldn't be very low. And then you have to start, if your doctor identified that there's a lot of alteration in the fetal heartbeat, they will start making steps, making sure that the heartbeat picks up. A lot of times early scans are done. We can see that the heartbeat is very low. We can see that sometimes it's around 80, 90. We put some blood.
Ma'am, sorry to interrupt. Actually, you're not sharing the screen. You wanted to share the PPT?
Yeah.
It has not been shared yet.
Is it seen now?
Not yet.
Let me redo that. Is it coming now?
Yes. Yes.
Okay, fine. Anyway, I'm sure we have a very smart audience who picked up all the numbers because most of the pictures will start coming in now. So just to brief up, you've already learned, more than 34 weeks, 34 days that we'll be able to see a good size baby. And then that is when we will pick up the fetal heart rate. And then we will be able to see a baby's heartbeat anywhere between 110 and 160. And like I mentioned, the activity starts at 7 weeks. And if it's very good scan, we will know. And these numbers you already know. And like I said, are the smartest audience we have for today. And the heartbeat keeps becoming more. So you warranted me very early, and we had a very good picture that all our audience can see, where we can see the fetal circulation. It's a little different from the adult circulation. And so many times, if the baby has been diagnosed that it has a cardiac problem, cardiac issue, we say, let's monitor the baby. I'll tell you how do we monitor the babies, especially when there's a cardiac alignment, which is diagnosed, because once the baby comes out, the first cry of the baby, there is a lot of changes happening in this fetal heart circulation. And small problems, like we call it as an AST, VST, congenital heart disease, they all get corrected by itself and the baby do wonderfully well. You can see here that on the red, it is going towards the baby, and then the purple, which is a mixed blood, that is the pure, and the one which is less of oxygen is all getting mixed up and then goes to the placenta. Placenta acts like a filter and sends the oxygen-rich blood towards the baby, and the circulation happens. And here it is almost different from the adult. And this is why that first cry is so important, because so many things change for the baby. And so many times in the antenatal period, because I work in a cardiac institute, so we see a lot of high-risk mothers with a lot of babies with congenital heart diseases, and we would have prepared the parents for surgeries, but then after the first cry, when we repeat the first echo for the baby, things would have changed. And we say, no, look, you don't need a surgery. Come back, and 3 months later, we'll repeat your echo, and then let's see what needs to be done. So while we are looking at the baby, while we're doing the scan for the baby, we can see a lot of abnormal rates and rhythms. Like I told you, the joyous moment is totally different. Listening to the heartbeat, everything is going well, is wonderful. But then we do have almost 20% of the babies, sometimes they have an abnormal heart rate. The rhythm's not good. So we need to evaluate, and the rate can vary depending on the gestational age. Like I said, we do have a lot of high-risk patients where the mothers itself have a lot of congenital heart diseases. So those babies have to be screened and seen. Is it all right? So the fetal cardiac anomalies will be done. We look into the family history. Your doctor will be asking you. So please remember and tell them if there's any family history of congenital heart diseases, because these things will help the doctor evaluate your baby well and send you home with a very healthy baby. Okay, and then sometimes there can be a little change in the rate depending on what stage of labor are you progressing. You could be in labor, you fully dilated, the baby is come down. We can see a little deceleration in the heartbeat. So your doctor will take a quick call to deliver you. Always leave it to the doctor, because your doctors are the best ones, because they make the best decisions for you. So trust your doctor, go by whatever they say. So listen to them, and I'm sure every doctor is working towards your health and trying to send both the parents, with a healthy baby. Sometimes during the process of your antenatal check or during the process of delivery, we can see that the fetal cardiac activity increases. The fetal tachycardia becomes more, and the heart rate is more. Remember, I told you anywhere between 110 and 160 is normal. We end up seeing where the heartbeat is like very fast, 160 to 180. I'm sure all of you know. Adults' heart rate can anywhere be between 70 and 90 is considered normal. We do have people with 50, 60, especially in the athletes who are working out very well. So on an average, if we take 70, 90 is good. Imagine your baby's basic heartbeat is 110 and it can reach up to 160, is almost double. So imagine how fast the heartbeat is going. So while you hear, you can tuck, 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 that is how it is, very fast. And these high rates sometimes can be telling us, look, there's something wrong with the heartbeat of the baby. So we could be diagnosing tachyarrhythmias. Arrhythmias means something which is very fast, which is more frequent, that is more than 160 beats per minute. So a fetal cardiac...
Hi, ma'am. Ma'am, actually the slides are not getting changed as you are talking. Yeah. I think we can do a slideshow and you can just click on the next button as soon as you're done.
Okay.
So the slideshow is not on right now.
Even now?
No. I can see the slides, but it is not full screen. So if we click on slideshow,
I've changed it on the slideshow itself.
Acha. Okay. So
okay.
Sure.
Okay. The fetal tachycardia can range anywhere between simple sinus tachycardia. So a fetal tachyarrhythmia can be there. Sometimes it is just the fetal heartbeat is a little high and there's a conduction defects, and that is how we will know. There is a lot of good prognosis even when the baby gets diagnosed that there is a lot of congenital heart disease or this tachyarrhythmias, there's simple sinus tachycardias. So that means there's a little variation. It's just that baby is completely fine. There's nothing wrong with the baby. It's just that the heartbeat is a little high. So the treatment options will be varying, where at times the technology is so wonderfully available now across the globe and including in India, where transplacental administration of antiarrhythmic drugs will happen. A lot of treatment modalities are available to treat your baby if they are diagnosed with a lot of congenital heart problems or any cardiac ailments that gets diagnosed can be treated. At times we see that fetal bradycardia, that means the baby heartbeat is becoming very low. So sometimes it is just a omnious finding. So it's accidentally you see that if you continue to see that the baby heartbeat is monitored by your doctor, they will tell you, look, no, it's just a momentary thing. And sometimes, even when your baby is moving inside your uterus, they will see that, the heart rate becomes higher. And when the doctor lets you listen to the heartbeat, you can see when the baby is moving, even the heartbeat of the baby will increase. It's the same like when we are running, our heartbeat increases. So it's the same with the baby as well. So the average rate can keep changing sometimes from lower to higher. And if the baby's heartbeat is less than 90 beats in the first trimester, then doctor will take a lot of decisions for you, add some medications, maybe call you more frequently to see you if everything is all right or not. Sometimes the low heartbeat persists and we end up losing the babies, and that's the most saddest moment for any parent. But then I'm sure all your doctors would have done the best for you. And the worst of the prognosis is if it is irregular bradycardia is there, there is a high probability that things can go wrong for you. But if the doctors picked it up very early for you, if they start you on a treatment, Your baby is going to do wonderfully well, and don't have any assumption, oh, in the first trimester when I went, my doctor told me the heartbeat was less. Is it okay now? It will definitely be okay once it is picked up and it is maintaining, and you don't have to be worried. At times, if we diagnose that there's a lot of problems associated, it's a multidisciplinary approach that we need to do. That means there are a lot of doctors from different specialities sit together to help you and make sure you understand. At times where we'll have to involve a pediatric cardiologist who can do your baby's heart scanning, and this is called as fetal echo to be done. Sometimes a rheumatologist must be needed. Sometimes a neonatologist is already available to discuss what is the plan once your baby comes out. A fetal medicine specialist will be called in. And throughout your pregnancy, things will be monitored well for you. And even when you are in the process of delivery, there's a lot of technology available to make sure your baby comes out very healthy. Things are very good for you. Can you believe it? Even when you are in labor, we can make out if there's any changes happening in your baby. So we do a fetal scalp electrode testing where some electrodes are placed on the baby's scalp to see, is the baby going into distress? Is there a problem? These are invasive testing. We do have non-invasive, that is without even getting close to the baby or without putting any thing on the baby's head. We can do a cardiotocography. That means this is the most useful one. While you're in labor, we have machines to find out if your heartbeat of the baby is good. Is the circulation good for the baby while you're getting contractions? Fetal magnetic cardiography is there to find, especially for these cardiac babies. Phonocardiograms are available. Fetal ECGs are done now. Can you believe it? Like the adult ECG, there are ECGs done for the babies when it is inside your tummy. Because fetal ECG, the recent studies are saying it is so wonderful that it can pick up a lot of things even at 28 weeks to tell us, is there a problem for the baby? And like I said, wonderful technologies available. So like I said, fetal echo sometimes will be done while, if you know that you already had a baby which had some abnormality in the heart, or if you've had a history of congenital heart diseases, or in the family somebody has a major cardiac problem, we always choose to do a fetal echo. That means we'll do an echo like how an adult heart will be studied, the baby's heartbeat inside your tummy will be studied to find out, is there a problem? So it will be done very early around the 4th month itself. So if that looks good, then we wait for an anomaly scan, and you know it happens at the 5th month. Everything looks good. We call you back in a month's time, around 24 weeks to repeat. And henceforth, it will be called again and again. Why early fetal echoes are done? So that we decide, is this good to continue a baby or should we take a decision? If nothing is there, no family history, nothing, and accidentally while they do an anomaly scan, if they pick up and warrant your obstetrician that, look, there could be something wrong in the heart of the baby, please don't get panicked. Discuss with your obstetrician. Like I said, they're always there to help you, reassure you, and make sure you're comfortable emotionally and mentally as well. So that is when you will be sent for a heart scan for the baby, and this is called as fetal echo, which will usually be done, and the best time to be done without any risk factors prior is between 22 to 24 weeks, and then done again if something gets picked. Most of the times, and the most common finding that we find is isogenic echogenic foci. We see that this is a small dot in the heart is a very common finding, because technologically, I said, all ultrasound machines have been very good and they pick up even the smallest of the thing. So once you do a fetal echo, 90% of the babies will be wonderfully well. If there's something else, like I said, a team approach, multidisciplinary approach will still help you go home with a beautiful baby. So during the labor, like I mentioned, cardiotocograph, non-stress test is done, which is attached on your abdomen to make sure baby is getting good blood supply even when there are contractions. And even by stethoscope, they'll be checking, like I said, all the fetal ECG, checking the scalp pH, and then baby will be monitored. So every time in your labor, if it's first trimester, 30 minutes, if you're in active labor, every 15 minutes, baby is checked. But if you're a high-risk patient, you will be checked more frequently. So be very cooperative with your obstetrician. Let them do their job. That is when all of us can be smiling, and then we can be joyous together as well. So like I said, your doctor is there only to give you the best of the results. So trust them. They will, while they're monitoring your contractions, fetal heart rate. They also check the baby's variability of the heart. Is it going high? Is it reducing? Is there an acceleration when something is happening? What if the baby's heartbeat dips when you're getting a contraction? That means while the contractions are happening, if the blood flow is going low to the baby, what is the patterns? All these things will be checked. Like I said, variability of even 5 to 25 beats per minute will be calculated. So they make sure that, baby is getting good oxygen, baby is not going into hypoxia, baby is not going to acidosis. All these things will be checked by your obstetrician while you are in labor. If there is some small suspicion, they'll be the best decision makers to see that if you need a cesarean, do you have to be delivered more quickly so that the baby is not compromised? And I always say, please listen to your obstetrician, because they will be thinking what is best. You don't have to go and say, do cesarean, doctor, for me. I don't want to go for a normal delivery, or I want normal delivery. I don't want a section, when your baby is having distress. No obstetrician is going to take a decision for a cesarean or normal delivery just like that. I'm sure if you discuss with them, they will tell you what is the indication and what is the best way for you to deliver. So it is a tailor-made process, and everything is going to go smoothly when the trust is built up. Sometimes why they want to do a cesarean when you're in labor and the heartbeat is dipping, because baby will end up with hypoxia and acidosis, and this can have a long-term effects on the baby, especially when there is persistent heartbeat of the baby keeps falling and remains low for a longer duration of time, more than 5 to 10 seconds. If it stays low, that means baby is not going to get a good oxygen supply to its brain, and then baby is going to be hypoxic, acidotic, and then we could be ending up having a problem. So like I always say, the trust between the obstetrician and the patient is the most important, because everybody is doing the best for you. But do not get worried when your obstetrician says there is a problem with the baby's heartbeat, either in the early scans or later scans, or even when you are in labor. If we see there's an alteration with the heartbeat happening, no need to panic, because everybody is geared up to send you with a bundle of joy. And I hope we'll all look for sending you home with a healthy pregnancy and a healthy baby home. Thank you. I hope this thing. We're open for questions, and you can ask me any doubts that you have for your pregnancy.
Thank you so much, ma'am, for that talk. I've removed your presentation, so we can come back to the main screen. Yeah. Okay. So, ma'am, I think I'll straight away move into questions.
Yes, please.
Richa is saying her baby's heartbeat is 170 per minute in 12 weeks. So if in 12 weeks, yeah. So right now she's 15 weeks pregnant. So is there something to worry about now?
No, definitely not, Richa. I think you can be rest assured, because whenever your obstetrician is seeing you, so it's just for a moment, okay? So even if your obstetrician is using an ultrasound to see and they calculate if it is 170, if we continue, it is not going to be persistently at 170, because even at 3rd month on a scan, you can see your baby was jiggling and moving, and could be that is a higher limit, and that is why it says it would all settle down. But then on a recurrent scan at 3rd month, if your NT scan has been normal, everything is going well, I really don't see any reason of why you need to be panicked. And I'm sure this is what your obstetrician would have also told. So stay assured, but then we can always see you again. And like I said, a little more extra monitoring for another 5 minutes, things would settle down. Baby would also be calmer, and then it would fall down. And 170 is definitely not to be worried.
Thank you, ma'am. I see one interesting question here. Doctor, is it true that heartbeat more than 140 indicates that it is a baby girl?
I wish somebody had told me this, and then we could predict and we could increase the number of girls, and I would have loved to have a girl myself, because I always say I'm very unfortunate that I didn't have a girl. And I don't think this is there at all. But then everybody would have got a baby of their own choice of sex, but not for my knowledge that I would say. Maybe we should do a study that way.
Yes. Komal is 6 weeks pregnant, and in the sonography, the embryo was not available, and they also can't see the heartbeat. What could this be?
Okay, Sonam, remember I spoke to you about what is the size of the baby, and that is when we could be seeing the baby's heartbeat. So your baby has to be at least 2 millimeters for your obstetrician to see a pulsation to be identified. What we do if we are seeing that there's a formation of the CRL, we call the crown rump length, and then we can't notice, we always, there's no sign of a bleeding, nothing. We call you back a little later of a week, try and do it. Do a scan again to see if the pulsation not picked up. In this meantime, your pregnancy is supported with a lot of progesterone and blood thinners, so the heart rate gets picked up. But if the baby is more than a good size of 7 millimeters, and then we are still not able to see the heartbeat, then we have to unfortunately say it's a missed abortion, and then baby is not healthy. And especially whenever the baby goes away before 3 months, most of the times I would say it is a congenitally abnormal baby, which is not fit for life. And of course, a lot of investigation needs to be done to see what was the problem and why the baby's heartbeat didn't pick up.
Thank you, ma'am. The next question I see here is, I'm 7 weeks pregnant. In the ultrasound, a small, well-defined hypoechoic area of size 12 into 7 mm is seen along posterior myometrium of uterus. Fibroid is detected.
Yeah. Okay.
Can it affect the growth of the baby, or will it be growing normally?
So, if the fibroid is very small and if it's in the myometrium, most of the times it shouldn't be a problem. We have a problem if it is invading into the submucosal area. We have to be worried. If it's in the myometrium, and I don't know if I heard the size quite well, somewhere around 2 centimeters. Anasuya,
no, ma'am, 12 into 7 mm.
That's why 1 centimeter. 12 into this thing is 1 to 1.5 centimeter. Really not to be worried. So that means your obstetrician is a very good ultrasound where she's been able to diagnose that you have a fibroid. You can be rest assured it is not going to cause any problem, because 12 millimeters is nothing but 1.2 centimeter. Definitely be ignored. But there's a probability that this fibroid can become bigger, but I really don't see that this could be causing any problem to your baby at all.
Thank you, ma'am. Ma'am, Aarti wants to know when is the right time to have the first ultrasound?
Depends. If you are a naturally conceived pregnancy, you can always go and see your doctor around 1.5 to 2 months time. So somewhere, even if you go at 4 weeks, 5 weeks, we're not going to do a scan for you unless you have conceived with ovulation induction or an IVF has been done. No obstetrician is going to do it. So the best time I would say is 7 weeks. If you have conceived spontaneously, would be a good time, because by then for sure the baby needs to be seen, a heartbeat needs to be seen, so that unnecessary scans can be avoided. Unless you have some symptoms like pain, bleeding, a scan well in advance is warranted to make sure that it is located in the right place. That's the location needs to be seen. Why did this bleeding happen? Is there any warranting sign of a threatened abortion? Then you would need an early scan. Otherwise, I think best is around 7 weeks is good for you to go and get your scan done.
Thank you, ma'am. Ma'am, Garima has a question for you. What are the complications one can face regarding baby's heartbeat during labor?
Okay, so I think there was an elaborate talk on during labor itself, Garima. I'm sorry if there was some technical glitches there. So what happens, like I mentioned, when you're not in labor, whatever heartbeat tracing that we're taking for the baby is called as an NST. That's a non-stress test to see is everything going well, is the baby heartbeat going up, going down. So each heartbeat of the baby needs to have 5 to 10 variability. When your baby moves, then it has to go up and come down, or 15 beats should go up and come. So while you get into labor, you need to remember that there are contractions from the uterus, and that is how the baby goes down. So while the uterus is contracting, trying to push your baby down, we also have to remember the oxygen, the blood supply gets cut off from the uterus to the baby. But then if it is a healthy baby, baby needs to sustain well, and the heartbeat keeps to be going on like how it was during the non-stress test, where the variability will be more than 5 beats. If it moves, then there is an acceleration of 15 beats. So during this labor, if you're getting contractions, so they'll be making sure that the variability is very good, the accelerations are there. But at times, what happens during the contractions, like I said, the blood flow is going to come down. At times, there can be a little drop in the baby's heartbeat. If there's a slight drop of 5 or 10 beats, and if it picks up immediately, we are not going to be worried at all for you. But if there's a drop of more than 15 beats, that makes me very anxious. And I'm sure it's the same with all obstetricians to see why is that dip there for a longer time. If it picks up quickly, they're going to keep you on a continuous monitoring to make sure, like I said, hypoxia, acidosis is not affecting the baby. The problem is once it dips down, stays down like a low heartbeat of more than 10 beats and for a longer duration is where we are in trouble. And that is when we have to take quicker decisions. Decisions like ARM will be done. What is your dilatation? Are you delivering? All those things have to be correlated. And this is how a baby's heartbeat will be monitored, mostly on the CTG. Like I said, now high-end technologies like fetal cardiac ECGs are done. Like I said, scalp pH is tested to detect earlier compromise in the babies as well. I hope that answers your questions, Garima.
Thank you so much, ma'am. So all the viewers, first we'll take heartbeat and fetal heartbeat related queries, and then we'll move on to general queries. So please don't mind if I skip your questions now. The next question I see here, ma'am, is I'm in the 20th week and I got my anomaly scan and I found a single umbilical artery. So does it have some impact on the next growth and how the baby will be growing eventually?
Sometimes single umbilical arteries gets detected and we don't have to be worried. We have to follow up to make sure that the baby grows well. There's no compromise in the baby. And I think almost around 5 to 10%, we do see the single umbilical arteries, and it's definitely not to be worried at all. But of course, we'll be watchful to make sure that the baby is getting good blood supply and things should go well for you.
Thank you, ma'am. Ma'am, Prachi just wants to confirm with you. I have recently done my NT scan. I'm 18 weeks pregnant and fetal heart rate is 151 and weight is 224 grams. Is it okay?
It's perfectly fine. Prachi, you're saying NT scan was done. So NT scan is done anywhere between 11, that's 10 plus 5 to 13 plus 5 to be more precise is when the NT scan will be done. So like I said, whenever your doctor is doing a scan, it's for that moment. So they would give you a number like 150, 151, 140. So please remember the baby which is inside is a live baby. So it moves, the heartbeat also varies. So there's a lot of variation. So between 110 and 160 is considered normal. So don't get worried. It is in the normal range. And that is how much your baby weight would be. As the baby increases, like you're an 18-weeker now and you're very soon due for your anomaly scan, where anomaly scan is done to detect physical or structural abnormalities, and the NT scan is done to detect any neural tube defects, nuchal translucency, where the neck thickness of the baby is measured to prospectively see if this baby is more risk for Down syndrome. So scan, whenever done NT scan, accuracy is almost 70%. So if somebody is about 30 years, options of dual testing will be given to them. NIPT plus blood test can be done, where the accuracy can be around 80 to 99%. When we do an NIPT plus dual test, it's around 80%. Amniocentesis, if indicated, which is 100% conclusive. So is the same anomaly scan done to detect physical and structural abnormalities. And if you do a scan and look at the weight at that time, your baby can be anywhere between 400 to almost 300 to 500, 600 grams is what we will be looking at. So it is completely all right of what weight and the heartbeat that has been seen at that time is perfectly fine. You don't have to get worried.
Thank you, ma'am. Ma'am, Geeta is 9 weeks pregnant. She says, I have conceived through IVF and doctor is doing scan every week from the 4th week continuously. Will it affect the babies? They are twins.
Geeta, don't get worried. So congratulations to you. I'm so happy for you that, you conceived and then you have double bundle of joy. And I'm sure your obstetrician has a reason of why they have decided to choose. I'm sure they must have seen some risk factors or, to just make sure that your babies are doing well. They must be doing frequent scans to keep them assured and keep you assured, because I'm sure while they do a scan and show you that heartbeat ticking on both the babies, it makes you feel joyous as well. So the doctor is doing it for your own good. Don't get worried. And please remember ultrasound. So what is that? The frequency of the sound waves that come from the ultrasound machine is so much lesser that you won't believe it, then my talking would be more injurious to the baby. So the frequency of the waves that come from an ultrasound, the frequency is very low compared to human beings speaking. So the ultrasound waves are very safe, and it's over so many decades that a lot of babies have gone through that it is proven that it is safe. So don't get panicked at all, Geeta, and congratulations, and please stay calm. And it's good that, you know, somebody is seeing and making sure and assuring you as well by showing the heartbeat ticking. So it's completely safe to go ahead with scans.
Thank you, ma'am. Ma'am, Navpreet is 5 months pregnant and having a lot of backache. She is not able to stand straight properly when she gets up from the bed. So any suggestions for her?
Yes, Navneet, very important that antenatal exercises needs to be done. I understand the pandemic is keeping us all tied up at home, but make sure you do some back strengthening exercise. Maybe you can meet up with your yoga therapist, ask your obstetricians to tell you about back strengthening exercise. You can, for once, I'm not a person who encourages Google at all, because, you know, that gives you a lot of misinformation, but then you can learn some back strengthening exercises in pregnancy and try to do them. Most of the times, all the back pain is because of the bad posture. Even look at me, how I'm sitting like this. I've got so relaxed with the audience, wonderful audience here. I'm just like relaxed here listening to the questions and all. So we need to maintain our posture irrespective of whether pregnancy or not. And that's the biggest culprit for anybody's backache. You know, so once you learn your postures well, try to maintain that. And if you're already in trouble, suffering with the back pain, back strengthening exercises is really going to help you. And talk to your obstetrician, so they will rule out if there's any other pathology. If despite of doing all these things, it doesn't get better, they will look into it and definitely help you out. But then back strengthening exercise will definitely help you overcome, so that you can get comfortably out of your bed, do your daily exercises, and a routine exercise during your antenatal period. Postnatal period is very, very, very important, because when you are fit, and that is when you are going to enjoy. Imagine every day you're suffering with the backache. You're like, God, why this pregnancy? So we want all moms to be so happy in their pregnancy, and that gets reflected onto the baby. So we don't see any reason of why you should be suffering. And talk to your doctor, do the back strengthening exercise. I'm sure things will get better for you, and you'll start enjoying and, you know, getting out of your bed and doing your daily course.
Thank you, ma'am. I think, Navpreet, you can join us in our live yoga sessions that we do on the app every alternate day. So we have one coming up tomorrow as well. We teach a lot of back strengthening and a lot of pregnancy stretches there. So we would love to have you there.
See, Navneet, the right question for the beautiful girl there, you know, who's organizing all these things. You know, see, this is how we have to reach out and ask for help. So everything is going to be available. And this iMumz platform has got so many wonderful programs. They get doctors across India just for you, to help you, for giving you out informations like Anu told us about the yoga sessions. Different obstetricians will be logging in to help your queries, and also stay in touch with this line and with Anu, and then you can learn a lot of things from here.
Mm-hmm. Thank you, ma'am. I see a question here. Amrita is asking, at what week can we hear the fetal heartbeat using a stethoscope?
So Amrita, I would say practically, if you're looking right at the stethoscope and just talking about it, anywhere around a good set from 26 weeks should be able to help. But if you're using a handheld Doppler, we use to see. So even at 24 weeks, we will be able to pick up, and then around 20 to 22 is good. But as a stethoscope, if you're listening, I would say we would need anywhere about 24 weeks to find out.
Thank you, ma'am. Ma'am, Achla has a question for you. She's 25 weeks pregnant. She says, can I take Fol 1 to 3 mf in place of Folivite active tablet?
Any folic acid is all right. It's usually a pen habit of a doctor that they write some particular brands, but then all you have to remember, the basic component needs to be folic acid. And most of the times, there's no need to add a folic acid separately because most of the iron tablets that you will be taking has folic acid. Excessive tablets, anything more than 5 milligrams is only going to be secreted out in either your urine or in your motion. So no need of popping in unnecessary medications if it's not required. But the minimal dose, if it is available, should be good enough. And the brand names are only a pen habit. So if the content is folic acid, it's still good. You can go ahead.
Swati has a question here. She is 5 weeks pregnant and she wants to know, is it okay to work during pregnancy and what are the precautions that working mothers should be taking?
Swati, congratulations on being a new mom, and I'm really happy for you. Please remember, pregnancy is just a physiological change, and we want all moms to be very active, super moms to be, so that you don't have to restrict any activity for yourself. Continue do whatever you've been doing, whatever you've been passionate about. So don't restrict your activity because it's just a physiological change your body is going through, and it's not a pathology that you have to be confined to bed like you have a disease and then not get out of it unless your doctor has instructed you. On a general note, avoid having sexual contact during the first 3 months of pregnancy. Avoid eating outside food. Avoid raw salads because if it's not washed well, then you can get a lot of GI infections. And avoid papaya, pineapple, grapes, cabbage, cauliflower, only because a lot of pesticides get used to this. So either you wash it very well and use. Just be a little cautious in pregnancy. Like I said, it's a physiological change. All you have to do is just sit down for a second, think about it, and just use your common sense and ask yourself, can I do this? Your own intelligent brain is going to answer most of your obstetrician, and you don't have to unnecessarily keep texting your obstetrician or keep calling them to ask, can I do this? Can I do that? It's a physiological change. Pregnancy is just a physiological body change. So you don't have to get panicked. Please continue doing everything unless you're not doing any strenuous kind of a workout or lifting too much of a weight. Shouldn't be a problem at all to continue your daily work.
Thank you, ma'am. Ma'am, I see some questions related to baby movement, so I'll quickly take them up.
Yes,
Navneet
please.
is saying, I'm 23 weeks pregnant. How do I feel? How does it feel to have baby movements? Is it a painful thing that happens on the sides or the stomach, or like how do I perceive them? I think that is the question.
Navneet, all mothers have their own ways of picking up. All babies will give the signs to their mums. They have their own way of saying hello to their mums. So don't get worried. If you're pregnant for the first time, usually the first movement, that is what we call it as quickening, can happen anywhere between 20, 22. Some babies take a little more longer time. Never mind. Each one of us have our own roadmap. So give the baby some time. Start watching out. What you could do is best ways, eat smaller portions. Take a walk for 10-15 minutes, come, sit down, put your hand on your stomach below your belly, because if it's less than 20 weeks or around 22 weeks, it's somewhere around your umbilical. So put your palm on that and you will start noticing a small trickle kind of a thing, small scratch kind of a thing, small tapping. It doesn't mean that immediately you put your hand, it's going to give you some signs. Start observing over weeks, couple of times in the day, especially after you eat, take a walk. You will start feeling small tapping, scratching kind of a thing. And after 20 to 24 weeks, it'll become a part of your this thing and you're waiting for the baby to kick. And once you start feeling that this thing, it's totally a different thing. And watching out for your fetal movements is also very, 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 very important. Unless somebody is pregnant for the second or the third time, they feel it more earlier, like between 18 and 20 weeks. Give your baby some time, Navneet, and it will definitely start saying hello to you very quickly. And definitely it's not painful. It's a joyous moment, like I said. Remember this and update on the iMumz and to Anu that, how did you feel your first quickening, and then what did your partner feel, and let us know about it.
Thank you, ma'am. Ma'am, Rashmi and Nutan are a little worried. They are not able to feel the baby movements yet. They are both in the 18th week. And also Spandana is in the 26th week of pregnancy and she feels baby movements sometimes, but sometimes she doesn't. So what is the reason for that?
Rashmi and the other girls, please don't get anxious. Stay calm. Like I mentioned, for the first time mothers, for you to identify, to feel the baby movement, you have to cross 20 plus weeks. And I would say for the first time mothers, since you've never had this, you don't know how it feels. Like, each one of us are assuming how it would be feeling. So after you start concentrating from 20 weeks, but then around 22, you will definitely feel, like I said, a small scratch, small tapping sensation, a different sensation, but make it a habit that you will do it. At 18 weeks, don't even waste your time. Go enjoy your life for another 2 weeks. Don't bother even trying to look for it because you won't be able to feel it. Like I said, only multigravidas, we say, that who's pregnant second time, third time, only they feel between 18 and 20. Otherwise, anything is 20 plus. Like I would always say, around 22 is the best time that you start focusing. Give baby each one their own moment, and they will pick up and they will do well. And for somebody who's at 26, what I always tell my patients is eat a small meal, eat small frequent meals. So divide your meal into 6 times a day. Like have a breakfast, smaller portion, go for a walk 10 minutes, come back and keep 1 hour just for you and your baby's time. So when you put your palm on your tummy and then sit there post meal, post 10 minutes walk, put your palm on your tummy and just sit there, you will be able to appreciate the movements. Okay, so at least in an hour, you should be able to appreciate around 4 to 5 movements. So do this repetition again in the afternoon, post your lunch, take a 10-15 minutes walk. By then the food also gets digested well. Most of the energy goes to the baby. You don't put on unnecessary weight and end up becoming diabetic. So post your lunch, again a walk, then put your palm again and you'll be able to feel the tapping sensation of the baby again 4 or 5. Repeat this act again in the night. So repetitively morning, afternoon, night, if you start monitoring, and in this 1 hour, you can feel anywhere between 4 and 5 movements is wonderful. But despite of doing this exercise of eating, walking, watching out, morning, afternoon, evening, you don't feel at all, please talk to your obstetrician. They will do a scan. They will assure you by showing the heartbeat. They will also check your Doppler, that's the blood flow to the baby. Is everything all right? Is there some deficiencies of the blood flow, insufficiency happening, and why this baby is not moving will have to be looked into it. But trust me, 90% of the times it is just that we are not concentrating. So do this exercise and I'm sure you'll be able to feel your movements if you're 26 weeks. And make it a religious practice to keep doing that. You will be able to appreciate it well.
Absolutely. Thank you, ma'am. Ma'am, Rokini is asking, I am 10 weeks now and I have severe nausea and vomiting. I've been taking Doxinate now and then to control nausea. I know I am not eating well. Will this affect my fetus?
Unfortunately, sorry to use the word, sometimes we end up calling fetuses parasites. So that means they will get their nutrition. Initially, we are most of the times worried about the mums. So what you need to do is eat smaller portions, eat frequently. That way your nausea is also going to be very less. And we are not expecting you to eat do rotis खा लो, 10 spoon चावल खा लो, ऐसा नहीं बोल रहे. छोटा खाना बार बार खा लीजिएगा. Eat small portions, eat frequently. That is what is required. Even if you can manage just 2 almonds, wonderful, I would say. Give another gap of half an hour, 1 hour. Small piece of apple, very good. You can eat 1 piece of an orange, excellent. Eat something or the other. And like I said, small portions frequently itself is going to reduce your nausea. You have to compensate your calories. So keep munching something. Forget eating, keep munching something frequently. That itself is going to take care of your nausea, and you wouldn't need any Doxinate to support you, and your baby both will do well. And please remember, this nausea is just a transient phase. I always say pregnancy comes in a full package of gifts. You cannot choose. You have to unwrap, and sometimes the wrapper is so much that you have to keep unwrapping for a longer time. So this nausea, vomiting is just a phase that you have to pass by, and most of them would settle up by 12 to 13 weeks. So you don't have to get worried. Make sure you keep munching smaller portions frequently and you will do wonderfully well, and including your baby is going to do wonderfully well.
Thank you so much, ma'am. Meenakshi has a question here. For protein source, I am taking protein powder. So can I take this powder as it is instead of mixing it with milk or water?
Perfectly fine, Meena. You don't have to get worried. You can take this, you can mix it with your curds, or you can make it chapatis, and your fulkas that you're making, you can mix it if it's not flavored. And then if it's flavored, and you can choose whatever flavor. And now the mangoes are there, your bananas, you can make smoothies. Start making interesting drink for yourself so that, you take adequate water as well. So while you make smoothies and all these things, put a little curd, put your protein powder, put a fruit, make a shake out of it, drink it. So it gives you good energy as well. And then you are also happy you're taking, even including natural sources of protein like your cottage cheese, paneer, and then, egg, dal, all these things are also rich sources of protein. You can include them. And if you wish and you are absolutely not a milk drinker at all, don't get worried. Like I said, you can either take it like that or mix it in water, mix it with your curd. Smoothies are the best way, especially considering the heat outside. Definitely fine. If you're taking it, that should be good enough.
Thank you, ma'am. Ma'am, Fasiha is asking, I'm 5 weeks pregnant now and I'm taking Sustain 200 mg. And okay, I get an A to Z tablet, I think that's what she means, and get severe back pain and lower abdomen pain. Is it because of the tablet or is it normal during this time?
Fasia, congratulations first of all on your pregnancy. And Fasia, remember, if you are already put on progesterone, Sustain is nothing but a progesterone. If your doctor has considered putting you on a progesterone, she must have seen some threat there, or she must have decided that this baby needs to be supported, and that is why she's taken a call to put the progesterone. Discuss with your doctor. And I'm sure you already complained to her that you have a abdominal pain, and that is why she's chosen to put on the progesterone. The progesterone, the Sustain, is only to support the pregnancy. So don't get worried. It wouldn't cause any pain abdomen, but sometimes it can cause a little nausea kind of a feeling, especially when you take it orally. There are different modalities or methods that you could be taking Sustain, especially you can insert it in the vagina, parectal region. So there are different methods if it is causing gastritis, but per se the progesterone leading into pain abdomen, no, no, no.
Thank you, ma'am. Ma'am, Alka says, I have a subarachnoidal fibroid of big size, approximately 10 centimeter near the placenta. Will it affect baby's heartbeat or baby's growth in any way?
How many weeks are you, if I may ask? And while you type that,
17 weeks.
17 weeks, okay. Is it subserosal, submucosal?
Subserosal.
Subserosal, stay calm, go home and sleep. Switch off your cameras, go sleep. You can be relaxed. Subserosal means it's outside the uterus, okay? So if it's outside the uterus, it's got nothing to do with your baby. Sometimes if it is big, it can cause pressure symptoms, so that when it is growing, it can cause a compression on the bowel, cause a little constipation, little irritation of your bowel. If it is in the front, it can cause irritability of the bladder. Your increased frequency can be there. Subserosal fibroids can, if it's big, can only cause pressure symptoms, but nothing otherwise to do with your placenta or the blood supply to the baby. No risk of any abortion. Of course, if it's very big, sometimes you can end up having a little pain because of degenerations and all. But trust me, on the placenta and the baby, no problem at all. If it is subserosal, stay calm. But if you end up having some pain, please report to your doctor so that they can look into it.
Thank you, ma'am. That's very helpful. Ankita here has a question. I am 18 weeks pregnant and hepatitis B positive. What precautions can I take to ensure that my baby does not get infected?
So we do IgG testing for you, and then we see the values, what is happening, so that you don't have to get worried. Only very important is while you're delivering, we do give you a vitamin K injection so that you don't end up bleeding and all. And the other word of precaution here is when you're having a sexual contact with your partner, please make sure you use a condom, and then it shouldn't be a problem at all. So meet up with the gastroenterologist and your obstetrician if you've mentioned and they've detected that you already hepatitis B. They will take care of you. They will do an IgG testing for you as well.
Thank you, ma'am. Ma'am, Radhika is asking, is it safe to use Sustain tablet twice a day?
Yes, but like I said, trust your obstetrician. I'm sure they would have had a plan for you. And either they would have diagnosed a progesterone deficiency or they would have realized that your baby needs a support to grow, and that is why they would have given to you. If you discuss with them, they will let you know why they've exactly started. But it is considered to be safe. You don't have to get worried at all. Continuing it twice a day should be still good.
Thank you, ma'am. Ma'am, Tanhim is asking, what could be the reason for sudden absence of fetal heartbeat during 28th week?
28 weeks is very unfortunate. I would say that, you've come a long way of 7 weeks and there, 7 months, and then you suddenly end up, especially when you go for a regular scans or a regular check, and they find it's very disheartening for the parents. But then we'll have to see, and if it is later, was there some congenital abnormality missed in the baby? Is there a metabolic disorder in the baby? What happened there? Was there a placental separation which happened? Did you suffer with hypertension and there was a bleeding and there was a sudden cutoff of blood supply to the baby? A lot of things needs to be evaluated to see, was the flow good for the baby? Was there any other problem? Most of the times, if it is 28 weeks, we either suspect, placental separations leading into subchorionic hemorrhage, abrupt shows, and all these things could be most of the causes, and metabolic disorders is something that we have to look into.
Thank you, ma'am. Ma'am, Varnashri has a question. Hi, ma'am. After my NT scan, I had been asked to take Ecosprin 150 as I may develop some complications during my 7th month. Later, in the 5th month, the graph was fine, but still the doctor asked me to continue the medicine, and I'm now in my 6th month and I've got gestational diabetes. Why is it like this, and how will it affect my baby?
Yeah. So I'm suspecting it the other way around. So your doctor would have done an NT scan, and then they would have done some blood tests, and your Doppler study would have done. They would have detected that you are high risk for developing hypertension. And that is why they would have chosen to put you on the blood thinners like Ecosprin, because if they put you on 150 milligrams, so that means they were suspecting that you are going to end up becoming a hypertensive, that is pregnancy-induced hypertension, PIH. This is why your 5th month scan has been done. They've checked on the blood flow again. It shows sometimes normal. That's because they've already identified you as a high risk and they've put you on these medication, and that is why it's normal. And more so the reason that you have to continue your Ecosprin 150, they've already started you on. At 7th month, which is the present gestation that you're running, we always do a testing called as glucose challenge test, glucose tolerance test, that will tell us, are you diabetic or not? The best time to predict is 23 to 28 weeks, because we can pick up the sensitivity around this time to do the glucose tolerance test is very high to pick up mothers who are prone to get diabetes. A lot of people overlap between hypertension and diabetes. I'm glad that your obstetrician identified you as a high risk for developing hypertension. They started you on Ecosprin, and that is why your BP has been normal. Your Dopplers have been shown. But now that you've been diagnosed to have diabetes, just see what is the range, discuss with them if you can modify it with your diet and continue taking the medications and work out, walk nicely, eat smaller portions, watch your calories, and regular exercise should keep things under control. Be in constant touch with your obstetrician, follow their orders, continue the medications they've given, because you will do wonderfully well if it is identified and then your obstetrician is screening you so frequently. I'm sure they're aware of what needs to be done for you.
Thank you so much, ma'am. Zeenath has a question here. Hi, ma'am. In 8 weeks, my baby's heartbeat was 114. Then my doctor recommended HCG injection once a week and Overmax 500 twice a week. And then after 4 weeks, the scan showed that the heartbeat was 169 per minute. Now, will the heartbeat stay in this range or it can drop later on?
Okay. Zeenath, I'll not be commenting about the medications there. But like I mentioned, anywhere between 110 to 160 is considered normal. So 114 is, since I'm sure they thought that it was on the lower side, they put you on some different medications. But then if your baby has picked up the heartbeat and it is maintaining, shouldn't be a problem. But then get your NT scan done on time, get your baby evaluated for Down syndrome, mental retardation, all basic tests will be done associated with your blood test. And make sure your anomaly scan, everything is done on time. If it is picked up, staying there, it is wonderfully well. And remember, it is not a static number that 160 means it's going to stay at 160. It's a variability between 110 and 160 and all these things are considered normal, because at every moment you do the scan, the heartbeat keeps varying and each time it would show a number. So it's a variability, it's a range of heartbeat numbers that we are looking at, and it's not a constant static number. So don't get worried. The baby is going to do wonderfully well.
Thank you, ma'am. That's very reassuring. So Poonam has a question here. I'm 27 weeks pregnant. How can I get to know via baby movements that my baby is fine?
So like I mentioned, Poonam, every day if you religiously count 1 hour in the morning post-breakfast walk and 1 hour, again religiously in the afternoon post your lunch 10-15 minutes walk and dedicated 1 hour of you and your baby time, and again in the night post dinner 10-15 minutes walk and dedicated time for you and your baby. And in this 1 hour, if you're able to appreciate good 5 movements is wonderful. So 5 morning, 5 afternoon, 5 night. So 15 to 20 movements in a day is reassuring for a mother and an obstetrician, because the first person to know that something's wrong with the baby is the mother. So obstetrician will also rely on the mother, because you are the one who are going to sense it and you will report it to the obstetrician. And the earlier you report, the obstetrician can really help and save your baby. The most reassuring is the fetal movements, and that is what you could do is 1 hour dedicated morning, afternoon and night, and 15-20 movements in a day is wonderfully well. Make sure that it maintains. That itself is a very good way to monitor.
Thank you, ma'am. Nagashri is asking, I have conceived with IVF, and in the last NT scan, they said that the placenta fundo anterior right side, they have suggested bed rest. I'm 14 weeks pregnant. So is there anything to be worried about, or things will be
No,
fine?
if you don't have any bleeding, I don't think you should be worried at all. The fact that they've identified, they would have supported, but refrain from sexual activity and refrain from lifting of any heavy weights and all. So you will do well if you are very cautious on your movements, and then watch out and report quickly to your obstetrician on the slightest note of a bleeding or a brownish discharge, so that early calls can be taken in order to save the baby. So shouldn't be a problem until unless you're watchful and careful with every movement you do.
Thank you, ma'am. We've run out of time. I'll just quickly take 1 or 2 more questions.
Sure. Definitely.
Okay. So since it is COVID time, I see a question here and I think it'll be relevant for all. So Manju says, I got COVID positive on 25th with a lot of symptoms. Now, please suggest me for a better health and quick recovery. What do I have to do in the 20th week of pregnancy?
Manju, I'm glad that you were already 20 weeks, So make sure you get isolated from everybody. Take care of yourself, eat fresh food, hydrate yourself very well, continue taking your vitamin Z, C, zinc, all these things. Make sure that, you do not go out. So do not go out. And I'm glad that you've recovered well. Keep doing good breathing exercises, so that increases your lung capability and the capacity of air filling. So all your symptoms gets better. So if you're watchful about every moment, you will do wonderfully well. Make sure that if your anomaly scan is not done, you refrain, isolate for the next 2-3 weeks, and post that you go and get your anomaly scan done. I'm so glad that you're doing wonderfully well. Keep doing breathing exercise, hydrate yourself, fresh food is very, very, very important, and exercise, please do not forget, and continue taking your medicines. Most of them do well.
Thank you, ma'am. Ma'am, I think you mentioned that it is not okay to have grapes in the first trimester. So somebody is really enjoying her grapes in the 3rd trimester. Is it safe then?
Yes, it's completely all right. See, first 3 months, why we ask you to refrain from these things are a lot of pesticides go into the growth of these things. If you actually go to a grape yard and see of how much pesticides they usually use, because if you're not cautious, in the first 3 months, baby formation happens. So there can be a lot of gene mutations which can happen. So post 3rd month, it's only that the formation is done and the baby becomes bigger. That's all. So by 3rd trimester, not to get worried. Even if that is your favorite fruit, make sure that you wash it well and eat well. So do not get worried. Should be completely all right. Go enjoy your grapes. But make sure all precautions are taken.
Someone is asking, why does my baby have so much hiccup in the womb? It is my 32nd week.
So not to get worried, it's an hiccup, movement, small leg movements or the small fist movements. It's trying to tickle you, moving its fingers, moving its toes, moving subtle movements. You may feel it's like an hiccup. And remember, like I mentioned, it's a happy, live baby there. So they're moving, they're jiggling, they're doing everything that they want to do inside, and it feels that way. So don't get worried at all. So just be happy, enjoy the movements, be assured it is okay. The more it moves, the more active it is, more healthier the baby. So eat well, concentrate, give baby its own time, so things will do well. Baby has got no problem if it is moving well. You have to be rest assured.
Thank you, ma'am. So Anjaneya has a question here. I think there are two queries mostly related to baby movements here. So I'll just take them up. So Anjaneya says, ma'am, after having breakfast, lunch and dinner or whatever, whenever my baby, her tummy is full, my wife's tummy is full, something's rotating in the stomach. Is that baby rotation? Also, one question I see here is, hi ma'am, I'm 20 weeks pregnant. I'm feeling like gas bubbles in a day. Can I consider them as baby movements?
Okay. First thing I would say is I'm glad the dads to be also have logged in and they're enjoying the talk. That gives us a good motivation. So congratulations to iMumz for such a great opportunity and platform for everybody to log in and, encourage. And it's so nice to see the dads be a part of, this pregnancy care. And they also want to ask questions is really wonderful. So coming to the question. So what happens if you're anywhere around 20 to 22 weeks, like I mentioned, the uterus is below the umbilicus. So once you eat, like I said, always take a walk. So that way your food gets digested well. So makes you feel comfortable so that your burping doesn't happen, because in pregnancy, there's a relaxation of the stomach because of the progesterone, which is produced within the body. So when you walk, the digestion is better. So sit down for some time, put your hand below the umbilicus if it is 20, 22 weeks and just stay there. And like I mentioned, you will feel a small tapping sensation, scratching sensation, and that is how it is. So if you're feeling something above the umbilicus, definitely it is not your baby movements. Give it time, you will know what it feels like, because how much ever I describe, it's giving me more joy, but then only when you feel it, you will enjoy it and you will know the difference. Just give it some time. Like I mentioned, eat, walk, put your hand religiously, keep doing it over a few days and couple of weeks. You will be able to appreciate what a movement is.
Thank you, ma'am. I think Anjaneya and his wife are already in the 23rd week, so probably they would be feeling the baby.
Yes, they will be feeling them. Yes.
Okay.
It will get only more intense as days pass by.
That's nice. Okay. Thank you so much, ma'am, for doing this session with us and patiently answering so many queries and helping them out. We were very, very excited and happy at the same time to have you on our platform. And to all the users, thank you so much for joining in and being a part of this.
Thank you, Anu. Thank you so much. I would really like to thank iMumz for such a great initiative, such a great platform for me and for a lot of audience to log in and imagine. The technology is so good, and iMumz have taken such great initiative of connecting different people from different parts, to come on one platform and educating them and sharing ideas, sharing their fears to show that, we all have our own fears. So like the pandemic itself. So don't get worried. Stay positive, think calm, stay good, stay safe, stay healthy. Make sure that you all mask up. Make sure you cover your nose and mouth, especially the husbands who've logged in. Make sure you educate the same, because nobody should get infected. Nobody should pass on the infection. That is the motto. And thank you, iMumz, for such a great initiative. And thank you all for logging in. And I hope I've helped you out with your queries.
Yes,
thank you, Anu, for being such a wonderful host and a chirpy, bubbly host.
Thank you, ma'am. We'll have you back soon with another interesting topic.
Thank you so much. It would be my pleasure.
Thank you, everyone, and have a great evening.
Thank you. Bye-bye.